Hello everyone, my name is Neha Patel. I am one of the non-invasive cardiologists here at Inside Chicago. Today I'd like to talk a little bit more about atrial fibrillation, diagnosing and treating the disease. To start off with, if you suspect you have AFib, which can be on the basis of symptoms, alerts from your smartwatch, or when you first find out you have atrial fibrillation, your care team will do certain kind of testing for you. It will start off with assessing your symptoms, asking you about your medical history, and performing a full physical exam. Thereafter, the diagnostic testing will start off with an EKG or an electrocardiogram where little leads are put on your chest wall and your arm, and your heart's electrical activity is captured in an instant, and it's routinely done during your care of atrial fibrillation. Other testing will include blood tests where we are looking for any thyroid problems or any kidney problems related to it. There is times when heart monitor is ordered for you, which is basically allowing us to look at your heart electrical activity throughout a period of time, which can be days or weeks. And this allows your care team, your doctors, to see if you have been going in and out of atrial fibrillation or you have a persistent form of atrial fibrillation. The other test which you might encounter during the diagnosis of this condition is an echocardiogram, where an ultrasound is used to look at the structure and function of the heart, and your doctors are basically looking for any signs of heart failure or any valvular heart problems. Let's talk about treatment of atrial fibrillation now. The good news is you can still have a long, healthy life with atrial fibrillation. However, if left untreated or uncontrolled, atrial fibrillation can increase your risk of having blood clots, stroke, and heart-related issues like heart failure. Your treatment will likely depend on your age, whether you are having frequent symptoms or frequent episodes of atrial fibrillation, whether your heart rate is under control or not, what's your risk of having a stroke, and your other medical conditions, including high blood pressure, diabetes, any other heart problems like heart failure or coronary artery disease. There are certain conditions which can trigger acute episodes of atrial fibrillation or worsen your heart rate control when you have atrial fibrillation. So please look out for any signs of infection, dehydration, heart failure getting worse. Drinking too much alcohol or taking any kind of stimulants can also cause these acute episodes of AFib. The management of atrial fibrillation starts with good lifestyle choices. And also it revolves around medications and procedures which will be needed to manage your atrial fibrillation. Lifestyle changes may include weight loss if you're obese or overweight, limiting alcohol use, if you have sleep apnea, being treated for it using a CPAP machine, avoiding smoking, making sure that all your other medical conditions are treated appropriately, taking your medications for atrial fibrillation regularly and as prescribed. In addition to lifestyle changes, treatment often includes medications. The medications which reduces your heart rate are often called as rate controlling medications, and these may include beta blockers, calcium channel blockers, and digoxin. There are a group of medications which can be used by a doctor to restore your heart into normal rhythm, and these are called rhythm controlling agents. In the future sessions, we will be talking about what increases your risk of stroke with atrial fibrillation and how to prevent this. We will also touch base about different procedures that can be used to control atrial fibrillation. To get more information about atrial fibrillation or any other heart condition, please log into InsideChicago.com.